Hi, everybody. Good evening. Welcome to the webinar. It is October 29th, 2015. Today, we're going to be talking about eating disorders and body image. The first thing that I want to say, and I'm going to end with this also, is that it's important, I think, that we understand, like all mental health issues, that there's a continuum. And in America, our relationship with food and with our bodies is anything less than ideal, right? We're all struggling. Well, many of us are struggling in some aspects of this. Even our perspective about what is beautiful, and a lot of those are being challenged in the media. So I think one helpful thing for all of us as we deal with loved ones who are struggling with body image issues and eating disorders is that we have compassion. That we also recognize that everybody has a medicator at times that they go to, right? Something that they do to soothe themselves that, if taken in excess, if practiced in excess, is not necessarily helpful. Again, that asks for empathy. And while eating disorders in their most severe form can be baffling to other people, it's important that we maintain that compassion. In my experience is it's only with that compassion can we treat it, react to it effectively in a way that is healing. Eating disorder is characterized by abnormal eating habits that may involve either insufficient or excessive food intake to the detriment of an individual's physical and emotional health. It's estimated there's between 5 and 10 million females and 1 million males in the United States that are suffering from an eating disorder. Those are broad numbers, but this is a significant issue. And if we were to talk about slightly overweight or overweight, to an unhealthy amount, I think that number would drastically increase, of course. These are what qualify for clinical levels. It affects all socioeconomic levels, right? There's not one particular branch that is excluded from this disease. 40% of 9 and 10-year-old girls are already trying to lose weight. That's phenomenal. Girls with ADHD are 5.6 times more likely to develop bulimia and 2.7 times more likely to develop anorexia. And I'll talk about what those are in a minute. Females with anorexia nervosa have a higher suicide rate than those with any other mental health disorder, and the general population up to 60 times higher, according to one study. Here's the amazing thing about anorexia and eating disorders, is that it's not only a life-threatening issue and a baffling one to understand, it is a very difficult one to treat. So those of you, and I suspect some of you, are interested in this webinar because you either have suffered from it yourself or one of your loved ones is suffering from it. The first thing that you deserve is the compassion of others. Anorexia nervosa has the highest mortality rate of any psychiatric disorder. That's amazing. Anorexia nervosa, although usually reported in white adolescent females, affects all races and age groups. The mortality rate for anorexia is 4%. Bulimia nervosa, 3.9%, and eating disorder not otherwise specified, which includes binge eating disorder, is placed at 5.2%. Males account for 5 to 10% of anorexia cases and 10 to 15% of bulimia nervosa cases. So it's much more predominant. And that makes sense to us, right? Because the value of a female in this culture historically has been how they look. So it's not confusing to us that there's going to be a lot of confusion and distress around how one looks and how one maintains what might be perceived by some is an ideal body size and body shape. It's important to understand, like with a lot of addictions, folks, that how it starts is not necessarily why it continues. And that's why when we start to talk about any medicator, drugs, alcohol, or food in this case, and we start to ask, why are you doing it? The reason that one started or experimented with it at first isn't necessarily the reason that it's maintained. And an important part that I'll talk about tonight, and this goes for all of us, sometimes we have to get out of the why game. Sometimes with these addictions, with these compulsive behaviors, that rational thought, rational approaches, understanding why isn't enough or doesn't contribute significantly at all to the cure or recovery of the disorder. The reason that people start any compulsive or any addictive behavior is the same reason they stop. They start it to feel better and they eventually stop it to feel better. Eating disorders can often be best treated when understood like an addiction because it takes a disciplined practice, right? It takes group support, part of a community. It takes being treated by people who understand, oftentimes, or in many cases have been through some version of an eating disorder. And it takes a certain kind of vigilance. That doesn't mean, and we know this from addictive, it's not about holding on with willpower, right? White knuckling it, as they say. But it takes a certain kind of focus, a certain kind of adherence to a program to be able to maintain healthy eating patterns for many people who have suffered from eating disorders. It becomes the language and the tapestry around which the family organizes itself, right? It becomes the theme. And no matter how hard professionals try to encourage families to not make the discussion about weight and size the issue, it's like for everybody in there, it's nearly impossible for them to get away from that language in the process. So while the weight and the health of the individual who's suffering from it, it can be managed by a doctor or nutritionist or both, it's really important that we start to have a different language around feeling and control and anxiety and self-esteem. Those are the kinds of subjects. The best thing about an eating disorder, and I'll talk about this in a couple of ways tonight, the best thing about an eating disorder for the person who's exhibiting it or has it is that it changes the discussion from feelings and issues to weight and food and calories and the scale. And changing the conversation away from feelings and self-esteem and self-worth and belonging and feelings, all of those, and changing the discussion from that to discussions about food and calories and size of pants. The eating disorder has accomplished one of its primary goals, which is to help the person suffering from the eating disorder not to feel, not to deal with their feelings. So it's really important. That's why one of my interventions historically has been when somebody's struggling with body images, I would say, okay, so you're fat. I'm talking to a 90-pound woman or girl who's 5'7" tall, and she's worried that she's heavy. So my response is, okay, you're fat. Now what do you want to talk about? Do you want to talk about whether I like you? Whether I find you appealing or acceptable or tolerable? Whether I find you adequate? Whether I care about you? Because I can talk about those things, but I can't have a rational discussion with somebody who weighs 90 pounds and is 5'6" about being fat. I can't have a rational discussion. And that's not really what we're talking about. So it becomes what the individual ascribes meaning to. If I am thin, I am lovable. If I am thin, I'm in control. If I am thin, I'm going to be appealing and attractive and have value in the world. And so it's important to understand, to go to those places of value, of esteem, of fitting in, of being loved. And to understand, at least as the provider or the family member, that this solution that is being attempted by the individual suffering from it will never rationally go away. Meaning that it can't be rationally debated or argued out of their mind. Because we're not talking about what we're really talking about. And when you apply a solution that's not about the problem, it's never going to work. Recovery, we believe, is a family reorganization. That means that the family members, this is true of many of the disorders that our clients and students come with, that a family participation in the disorder, around the disorder, serves to maintain it, serves to reinforce it unconsciously. So part of what we try to do is treat the whole family at once and change the dance. And I think a lot of you can understand, it doesn't matter if your child struggled with this or not, you can understand how it's hard to get out of those patterns. It's hard not to talk about food and weight, especially when the binge eating or the restricting or the purging is so profound and really is in your entire face. This is a quote. Much of this webinar is taken from the book Making Peace with Your Plate that I listed in the beginning. Robin, the individual who wrote the book, said, "My eating disorder was like a guest I'd invited to party at my home on weekends, but who ended up living there permanently, rent-free. Then slowly, quietly, it began to dictate my every move. At the beginning of its stay, my guest was fun and promised me a good time and ways to feel like I fit in. I welcomed that. And then it turned on me, and I didn't know what to do I didn't want to do the things it wanted me to do." And so that tells you a little bit about how, yes, experimentation with this makes you feel a sense of control, makes you feel a sense of well-being, safe, even a rush, an inflation, because I can control it. While it might start off that way, as with any compulsive or addictive behavior, it can eventually lead to an addiction, something that you have no conscious control over. I dropped my mouse, so excuse me. So this is the most text-heavy slide. I apologize, but I just want to get a few definitions out there. Body image is a term which may refer to a person's perception of his or her own physical appearance, which in many cases may be dramatically different from one's objective physical condition or how one is actually perceived by others. And again, the natural impulse of somebody who says they're fat when they're underweight is for people to say, no, you're not. And if that worked, we wouldn't have eating disorders. So the discussion has to change. Like a lot of times, we have to change the discussion. We have to change the question. We have to say, so what? Then what does that mean? We can talk about that. Anorexia is a refusal to maintain body weight at or above a minimally normal weight for age and height. For example, weight loss leading to maintenance of body weight less than 85% of that expected. Or failure to make expected weight gain during period of growth, leading to body weight less than 85 of that expected. And it has an intense fear. Remember, this is terribly frightening. It is incredibly shameful for the individual who suffers from it. There's an intense fear of gaining weight or becoming fat, even though they are underweight, because the potential consequence of being overweight, even though they're grossly underweight, is that nobody will love me. I'll have no place. That nameless dread of rejection and loneliness. From talking about binge eating disorders, recurrent episodes of binge eating. An episode of binge eating is characterized by both eating for over a fixed period of time, an amount of food that is definitely larger than most people would eat under similar circumstances, and a lack of control over eating during that episode. A feeling that one cannot stop eating or control how much one is eating. Recurrent inappropriate compensatory behaviors to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or other medications, fasting, or excessive exercise can also be present. And again, I would imagine, this is not a stretch to say, everybody has experienced a mild version of this. But this is severe. This is thousands of calories per sitting. And oftentimes, like it said, in the case of bulimia, it's followed up by purging or by other compensatory behaviors that are unhealthy and medically unsafe. It's important that we turn the discussion to emotions. The references there are the pages in the Kindle version of Making Peace with Your Plate. To learn to have a healthy relationship with your emotions. I heard somebody describe recovery one time, a professor in college described recovery from any addictive behavior is like having a torrid affair with your emotions, right? You begin to have a real intimate experience with your own emotions. You have to learn that feelings aren't going to kill you, that they're okay, that they're not broken when you feel pain or sadness or fear. Learning to improve response flexibility is a part of it. Learning to be able to respond to things without the same knee-jerk kind of reactions. Understanding and ascribing value to suffering and understanding that it's part of the human condition. It is and isn't about food and weight. Dig deep and keep asking, what feeling are you looking for? That's a key idea. Feeling bad about oneself can lead to high-functioning or low-functioning behaviors. So I can see both kinds of defenses in people that I treat. And in some ways, the person who suffers from restrictive eating often experiences this inflation of self-mastery because they can't control what's outside of them, right? They can't control the things in their life. So if they can control the food, there's some sort of sense that they're controlling the things or the feelings that they have, and they feel inflated about it. They feel in control. Sometimes, even in the culture with eating disorders, the anorexics look at the bulimics as lazy or gross or disgusting. And the bulimics will look back at the anorexics as insane and crazy. They have these kind of turf wars over how they see each other. And then, of course, there's intense shame around it. Intense shame is the foundation of it and also the result of it, where one wants to disappear. You know, the suicide rate, like I've talked about when I talk about suicide in essence is the human psyche saying, I want to disappear. And what we have to learn is there are things in us that we can let go of without dying altogether. Treatments, I'm going to have a few slides on treatment and a version of treatment that was presented in the book, Making Peace with Your Plate. Cognitive behavioral therapy. Learn to challenge the twisted thinking is a part of it. And doing it without confrontation, without debating, but through a Socratic method. The motivational interviewing method, which is to point out discrepancies by asking questions. Dialectical behavior has been shown to be effective in treating bulimia and binge eating disorder, although research has yet to solidify a therapeutic approach that shows overwhelming superiority in treating anorexia nervosa. Many of my clients, this is from the book Making Peace with My Plate, have appreciated the concrete nature of many DBT skills in their fight against eating disorders. I was treating one particular eating disorder in outpatient years and years ago. And there's actually a quote later on in this presentation. People that practice, have eating disorders, are oftentimes incredibly high functioning in other spheres of life, academically and at work and so forth. They have what you might consider a tremendous ability to not feel, which looks kind of like discipline, right? And so what I learned after a while is that this individual who'd been through several treatment centers before having me as an outpatient therapist, that it got to the point where we had to just do stuff because talking about it wasn't making a difference. She eventually entered the wilderness program because the prescription was to feel. And there was no better context that I have ever seen that required her to feel, that removed the distractions and the medicators. Sometimes she would blackmail me that if I talked about or gave rules about food that she would restrict more, in which case I would just make larger requirements. I wasn't going to be blackmailed by it. Sometimes to have a session, I would make her eat a fairly fattening food to be able to have a session. And then if she stopped eating, I would stop the session. So some of it was even treated with behavior mod. And then we were giving her skills and tools from dialectical behavioral therapy to manage her emotional dysregulation, to radically accept what was going on, to practice safe self-care, and so forth. Family therapy is a part of it. Art therapy can be a nice way into it. Of course, nutrition counseling often is a part of it. At Evoke therapy programs, we're not going to take an acute situation that is currently life-threatening, right? That requires access to medical services 24/7 to keep the individual safe. Subacute we can take, right? Still participating in some of the behaviors, but not to the point that there's potentially a daily threat. We can do some observation of nutrition and have a diet that's suggested, monitored by a nutrition, but again, it's less than acute. We would recommend an eating disorder clinic in the acute cases, medically threatened cases. Sometimes medication can help with anxiety and depression as a part of it. Sometimes anxiety medication that is used to treat depression can have the effect that the person experiences less of the cravings, those cravings to overeat or those cravings to undereat, to restrict. Self-help groups can be powerful like any other addictive behavior where you're sitting with peers who have had the same experience and are now in recovery and can share from peer to peer what it takes to be in recovery from this disorder. Both eating disorders, Anonymous and Overeaters Anonymous, are based on the traditional 12-step program pioneered for Alcoholics Anonymous. Again, based on concrete steps and actions around shame, accountability, openness, vulnerability, surrender and humility, service. In wellness treatment, there is an intrinsic de-emphasis on body image because everybody wears the same thing. There are no mirrors. And so one of the things that can be accomplished in the wilderness for all of our adolescents and young adults is that there's not that much focus on how you look, just intrinsically, implicitly. Focusing on accomplishment, that motivation is bolstered by accomplishment, by the experience of overcoming something difficult, of demonstrating resilience. That increases motivation and optimism. Interpersonal skills are improved, learning to assertively express yourself, your truth, and learning how to communicate that and listen to that in a more effective way. The family that is initially in wilderness therapy pulled apart and subsequently is reorganized, equipped with some new skills so that when they do connect, it's a much healthier, much more effective connection is a part of it. The addiction and 12-step approach can be and oftentimes is an effective method because it doesn't emphasize the why, the psychodynamic, the developmental, the Freudian version of the addiction, but what are the pragmatic steps that I can take to be able to develop a program of recovery and to understand the function of the system. This is something I was talking. I mean, the eating disorders serve so well the individual who's suffering from it. It gives them a sense of control, not only of themselves but over other people, right? So instead of dealing with understanding that we can't control other people, we have a sense that we're able to pull the strings of other people, right? And we have a sense that we can manipulate other people. And that's what an eating disorder can accomplish. It has this pseudo sense of power, like I've described in a couple of examples already. There's this inflated feeling. It's nice to get secondary gains from attention from parents. Oftentimes, the person with an eating disorder will describe this sense of feeling distant from one or both parents and how this pulls them in. Requires them to show up to therapy sessions, to show up to group, to show up to discussions because the child is dealing with a life-threatening issue. Understand body image thinking errors. That takes a long time and is not going to be accomplished, like I said, through debate or simple confrontation. Peer feedback can be an important part of it. Learning to develop a healthy... Oftentimes, eating disorder clinics will talk about shopping with the young women or men and about going out to restaurants. Learning, practicing, having a healthy relationship with food and with your body. Even shopping for clothes can be an important part of it. And we can do some of that, of course, in the wilderness. Developing mindfulness. Learning to eat mindfully, learning to feel your body, learning to love your body, learning to appreciate your body, be grateful for your body, can all be a part of the mindfulness practice. Body awareness and building resiliency. Developing a sense that you can go through difficult things, and it's going to be okay. It's not going to be a disaster. Families need communication training in this process. They need to learn how to change the dialogue, change the discussion. Specifically learning how to listen better. Not getting into shaming message, arguing, debating messages, an angry response. Learning to be more assertive, honest, and having a communication that helps develop awareness in oneself and between people. Understanding the difference between control and influence. I tell stories all the time. Another eating disorder client that I had years ago, when I was encouraging the parents to set some boundaries around the house, and they had been through, again, many months or maybe even years of treatment at some of the best eating disorder clinics in the country. And when I was saying to the mother, okay, these are some of the boundaries you can have and some of the rules, and if she has a certain potassium level, she can be on the cheer squad, and if there's a certain amount of time where there's no binge eating or purging, then she can drive the car, and if she relapses, then she loses the car. Some simple behavioral things. And the mother corrected me and taught me and said, Brad, you don't understand. Eating disorders are about control. We learned that at UCLA. We learned that at the Center for Change, and so I just want you to be aware of that. And my response was, and I was quoting some things that I'd heard her say over the weeks prior, I said, that's not controlling. Controlling is when you tell her that she's disgusting. When you tell her that no man is ever going to love her and that you would have never done this to your mother. That's controlling. It's emotionally coercive and shaming. When you ask her why, and you don't mean why, you mean you're crazy or you're an idiot. That's what the why question means. Those are coercive, emotionally shaming messages and responses. Simple boundaries from a place of love, healthy self-awareness and connection, those can be okay during part of this process. And learning to redefine those boundaries, the emotional boundaries and the physical boundaries. Reading can be a part of it, and again, going to support groups can be a part of it. So parents learn to understand it. And like I said, families that suffer from this get an incredible education in mental health and in eating disorders specifically. In the book, Making Peace with Your Place, they explain a 3-tier approach which they've trademarked. And the first one is the structured approach. This is primary treatment. You can't trust your body yet, right? You need structurally to be taken care of and to have structure around you to support healthy and safe eating. And oftentimes, this can look like an extended period of time in primary and secondary care. Primary being acute eating disorder care, secondary care being therapeutic programming that's more generalist, that understands it and supports it. Working with a dietitian can be an important part of it, often is, especially at the acute level, always is at the acute level. Come up with and develop relapse prevention plans, problem-solving plans, a healthy exercise plan, getting feedback, developing that, practicing that over time. This idea that you're never in this initial phase, and maybe ever, going to be fear-free. But do what you need to do, not because you're fearless, but because you refuse to let fear dictate your life. So it's this idea that we learn about that courage is not the absence of fear. That would just be doing something that somebody finds easy to do and nothing special. But learning to walk into the fear and the discomfort. Being willing to feel things that we weren't willing to feel before. The second approach is the mindful stage or approach. The mindful approach is about paying careful attention to your cravings, the flavors of the food, how you experience changes as you eat, and when food becomes less enjoyable to your taste buds instead of paying attention to your thoughts and emotions. So you start to, we do mindful eating in the program. We have lots of mindful activities. And when I participate in mindful eating, how many times do we just watch TV and feed ourselves? That's not necessarily having a relationship with our food. And so when we learn to pay attention to how our body feels as it's being filled, how the food tastes in our mouth, we chew very slowly, right? That's a good practice to ground oneself and having body awareness, having a connection between the mind, body, spirit that we talk about at Evoke all the time. Tuning into your body's mind, rejecting the lies that your eating disorder tells you, and then learning to get to the stage where you can intuitively eat because you've developed this awareness and this trust that comes from it. Learning this idea of maintenance and self-care. This is the middle path between self-indulgence and self-deprivation. Understanding what that is. Understanding where that is. Becoming comfortable and practice that. The self-care approach is eating for optimum health. The self-care approach is both mindful and structured eating, not depriving, or rigid eating. So you're building on the foundations of the first two tiers. You continue to challenge your twisted thinking. You're aware of it. You have people in your life, like a sponsor, that can challenge you on it, or a therapist. You don't need this level of structured eating to stay out of your eating disorder behaviors anymore. Right? You're capable, with some support in the ways that I described, of staying out of it. And you learn to have a healthy relationship with your own esteem, with your imperfections. Recovery, Robin says, recovery for me showing up for myself and others. Recovery means being able to be present. It means accepting imperfections and life on life's terms. It means feeling my feelings, and with that, experiencing real pain, real discomfort, real happiness, laughter, hope, and me. Recovery means experiencing the sensation of running, but standing still anyway. It means laughing at myself sometimes. It means being open to the magic of our glorious and sometimes scary world. I reflect on this to remind myself of what I can do now that I could not do when my life was dictated by body image and eating disorder anguish. When I get quiet and find the one thing that recovery means to me, other gifts, other things that I can do in recovery come flooding in on me until a sense of gratitude permeates my being. So this is her beautiful description of what it feels like, what it's like, what kind of sensibility one has in recovery. So the take-home message, it's not about the food. It's not about the weight. It's not about the scale. And as long as the discussion stays in those areas, although in the early stages of structured eating, those things have to be monitored. If it stays there, we'll never address the root issue that somebody's eating for a sense of well-being. Right? That's really how we know we're participating in an addictive activity, is we're taking in this medicator, we're participating in this medicator, because without it, we don't have a sense of well-being. It's about the emotions and the feelings. There is a cat and mouse game to it, a power struggle, like any addiction, where dishonesty and deception is present in many ways. And so parents who think I need to trust them or their self-esteem is going to be devastated by my mistrust are falling into a trap. People that are in recovery know that part of their disease is lying, that comes with it. And they're not offended when somebody doesn't trust them. They respect that. They almost need that. And there's no shame in it. There's no anger in it. It just is. There is an experience of being out of control. The person has very little conscious control, needs other help, needs other support, needs outside intervention. Like I said, it becomes the language and the tapestry around which the family organizes itself. I've had many clients in the wilderness whose parents, week after week, were talking about weight gain and weight loss in the program. And I was trying to get it to a different discussion, a discussion of powerlessness on their part, of listening and connection on their part, and of course on their child's part, of focusing on the underlying issues and feelings of which the eating disorder was a voice for. Learning how to self-soothe and find tools. Meditation can be a part of it. Learning to participate in exercise activities that aren't compulsive and compensatory. Recoveries for the family, the entire family. Learning to see the similarities with all medications and symptoms is a sign of flexibility and mental health maturity. So that's for the entire family, right? That I don't have that disorder, but I can relate to it. I can see the similarity across all mental health and unhealth. I can start to see the similarities, and it's a sign of growth. Seeing differences is a sign of a lack of growth, of a lack of emotional, mental health maturity. So I don't need to spend time on the why anymore. That will be an unending pursuit that will lead no results. And learning to stay away from control, but this does not mean for anybody in the family being passive and inactive. I'm going to be assertive. I'm going to be courageous. I'm going to take powerful steps, but I'm going to stay away from controlling and coercive in my idea that I have to control the other person to feel okay, to feel a sense of serenity. All right. What about someone who overeats to soothe and knows they're increasing obesity, not bulimia or anorexia? I didn't mention that, and overeating is one of the disorders. That's why Overeating Anonymous exists. And that's why in America, many Americans are overweight, and it can get to dangerous levels. But it's the same kind of medication and can use the same kind of treatment and has the same kind of feelings and issues of shame in it. So yes, it's not, I didn't address it specifically. I talked about binge eating, but it can be gradually increasing in weight and will take the same kind of treatment, the same kind of response. So sorry about that, and thank you. I remember I was talking to somebody years ago. This was during one of my graduate degrees. And I was talking about how when we overeat, any of us, even those of us who don't have weight issues to speak of, that we're doing it for emotional reasons. And I remember, again, I was talking to some friends who were my age and we were in our mid-20s. And I remember they were struggling with that and saying, that's not true. I just like it. And I remember being blown away that they couldn't see the connection between I just like it, but I'm eating to the point of feeling sick or uncomfortable. And there's no reason for it. It is the same compulsive behavior. I'm doing it to soothe myself. I'm doing it to give myself some sense that I don't or can't have without it. All right, if you're in New York City, please come to our play. You're invited. Let us know. You can go to our Facebook page to RSVP or our Twitter account, or you can email us at webinar@drbradreedy.com. We have parent support groups coming up. I left that on there again. It's 6:30 to 8:30. 6:30 to 8:30 on November 19th. And I will be there along with Gregory Koufakos, who's running it with me, and our executive director, Rick Heiser, will all be there. So that's the address there. You can contact Stephanie to RSVP. And then in Los Angeles, that's passed. So you were already there. We'll announce the new parent. In fact, we just released a blog today on the parent workshop that a recent parent went to it. So if you want to find out about the workshop, we'd like all families that possibly can go to the parent workshop. Here are the upcoming intensives. They are filling up. So we have Finding You for any adult, Heroic Parent for any parent. Doesn't have to be couples. And then we have additional intensive dates that we'll be assigning names and themes to as we go forward. Pursuits is this can be individually tailored for families too, our high adventure courses. We want you to go to 6 meetings while you're at Evoke. So don't wait till the end. Don't wait till afterwards. We want you to go to 6 of these. They're free. There isn't a lot in this process that is free, so it has that benefit. Follow us on Twitter, Facebook for announcements, for new blog posting, inspirational quotes. There's the book. Any other questions before we close, Michael? All right, Monday, one of my very favorite topics because it is so rich and is one of the hot topics later, and that is trauma. We'll be talking about talking about trauma on Monday, November 2nd at 6:30 p.m. Mountain Standard Time. All right, one more question, Michael, and then we'll end. Any thoughts on holiday dinners, family members with eating disorders? Gosh, that's a great question and really could take a long time. I don't know that the holiday dinner itself is the greatest venue to have some of this, but for the family member is to not obsess, not talk about the food, not focus on it. Again, if you see an individual in your family having a relationship with food, a relationship with food issues, and you're going to see that at times during the holidays. For it not to become your obsession, for it not to become something you control, for you not to talk about the food itself. My discussion around that would be, are you not feeling okay? I would talk about that before or after. How are you feeling? What's going on for you? What kind of stress are you having? Having that kind of discussion beforehand or after the fact would be more helpful than focusing on the consumption or lack of consumption during a holiday dinner. Those kinds of things would be very difficult and very ineffective. But discussions around feelings, stress, anxiety, making plans ahead of time could be very important. Talking about it afterwards, talking about feelings, talking about what the experience was like, talking about them feeling overwhelmed, those kinds of things. One more. This will be the last one. We have a daughter who is a 15-year-old ballerina. She is not underweight but does have concerning eating habits. She hides food, and the food that she does eat seems to be junk food. What is the best approach for addressing this with her proactively? Same kind of thing. Ballerina, there are several professions that are especially prone to this kind of thing because there's such an emphasis on the body in ballerinas and dance and other things like that. And so you're already in a high risk area. So beginning to have discussions around, and that's why it's not one simple solution, but let's have a healthy relationship with our bodies, with our feelings. Let's talk about and give a place, an avenue, a venue for her to talk about her anxiety around it. Let's talk about what it's like to be told by your teacher or looked upon by others as being heavy when you're really not. And so, you can see some distorted eating that she's struggling with, and she's in a high-risk area. So begin to talk about how she feels about her body. Begin to talk about how you feel about your body. Begin to talk about patterns that you could fall into, like trying to control her or manage her or obsess over it with her. So when you find food that she's hoarding or junk food that she's eating, if you focus on that instead of saying, so what's going on? How are you feeling? If you can change the discussion that the eating behavior doesn't win, it doesn't accomplish what it's intended to accomplish, which is hide the person, prevent the person from authentically feeling and suffering and struggling. All right, everybody. Thank you for joining us. Thank you for the questions. Hope this is a helpful point of contact. I will talk to you Monday evening at 6:30 p.m. Mountain Time. Don't forget to set your clocks back. Have a great weekend and talk to you then. Bye-bye.